Well, it is so wonderful to have Dr. Saray Stancic here with us here on Noted, a news of the day with a True Health Initiative, to talk about, a really wonderful new book. What's missing from medicine, I think, is going to be a critical uh, book that the public and frankly physicians need to read. Uh, Sarai, but first and foremost, just thank you for what you're doing to promote lifestyle as medicine and to get really right into it. Your background is so unique in how it led to this. And frankly, at the time that we're in the middle of this pandemic, having a combined background of internal medicine and infectious disease and what you've gone through is just really unique insight. So if you don't mind, let us introduce you by allowing you to introduce yourself, and particularly just a little bit about your credentials, your background in medicine.
Yeah. So thank you, Tom. It's a pleasure to be with you today. By training, I am an internist and infectious disease specialist. I went to medical school in the late 80s, early 90s. And as you know, regrettably, that was a period coincident with the height of the HIV epidemic. And as you might imagine, in that experience, I witnessed so much morbidity and mortality, and I wanted to be part of that solution. So when I completed my chief resident year in internal medicine, I went on to a fellowship in infectious diseases, really with this HIV/AIDS epidemic in mind, and how best to combat it. And when we look at the marvels of modern medicine, and it's really quite extraordinary when you think of HIV/AIDS, which was a death sentence, essentially. And really, in the span of my career, we've taken that diagnosis, and it's really more a chronic disease now that we can manage with this armamentarium of antiretrovirals. Obviously, we want to prevent the infection at all costs, but we can manage this disease with the advances that we've witnessed in the past couple of decades. And again, even today, Tom, in the midst of the COVID-19 pandemic, in less than a year, we have developed now 2 vaccines. We're on the eve of approving a second vaccine. So it is quite extraordinary what medicine has been able to accomplish, the advances that we've arrived at. But with that said, the title of my book, What's Missing from Medicine, we've missed the very basic foundation of health and well-being. This is something that is largely ignored, and it is so powerful. We have this all-important intervention that is what we uh, speak to as lifestyle medicine, addressing the importance of our nutrition, our movement, our stress, how we sleep, how we interpret um, difficult moments in our lives, that substance abuse and interconnectedness. They're so incredibly powerful, and yet the field of medicine has not really spoken to it. And we can save, as you know, so many lives and prevent so much disease, and improve quality of life. And so that's really what's drawn me to all of this. And the book is a simple message, really. It's a conversation that I would have with a patient during a consultation. And I hope that it serves to bring awareness to how important these simple decisions that we make every day, and how they reflect health outcomes.
Absolutely, yes. And yet, in your own personal journey, there was a very specific moment in your residency that we really need to discuss, and I think has made you not just the professional, but the person with the personal experience to effectuate change in a way that's very different. Now, of course, there are great specialists in lifestyle medicine that may not have had your experience, and I'm not saying that you have to have had cancer to be a good cancer specialist or anything like that. But there is something particularly powerful about how you applied it to yourself, and yet also, of course, are an evidence-based medicine practitioner, of course. But can you let us know a little bit about that 25 years ago, almost to the to the month almost, experience you had, and some insights that really initiated and gave impetus to your journey, really in delving into lifestyle medicine with a passion that's almost unparalleled.
Yes, so I've arrived at this point, and it all began on October 11th, 1995. And on that day, Tom, I was a third year medical resident on call, as I would, a typical busy night. And if you would have spoken to me on the morning of October 11th and asked me, how do you feel? I would have said, I'm fine. I'm tired. I'm on call every other day, or as you know, an internal medicine resident is fatigued. But I started this call I would any other, and I noticed that I was feeling really, really tired. Around 3 o'clock in the morning, I finally found an opportunity to get to the call room to take a nap, and Tom, I hit that pillow and I was out. Within, of course, you're in the middle of a call, you're going to get paged again. So probably 30, 45 minutes later, I get paged again. And I tried to get up. I couldn't feel my legs. It was that acute, that abrupt. And panic set in. I had no idea what was going on. And physicians, of course, are the worst patients. I immediately called for help, and I was brought to the ER. An MRI was done and it confirmed a diagnosis of multiple sclerosis with multiple lesions in both my brain and spinal cord. And the neurologist came to see me and said, you have a lot of disease in both the brain and spinal cord, and you can expect that within 10 to 20 years, you'll be in a wheelchair. And that was just the worst moment in my life, because all of a sudden, it felt like the end.
Yeah.
And
Unbelievable though, and I'm sure that it from what I understand too, just to show some of the the gusto you have, though you didn't feel it, you did nevertheless complete your residency training, right? It didn't.
I did. I fought through it and went on to do a fellowship. Yeah,
An infectious disease.
an infectious disease.
Absolutely. I mean, so there is no question you are an example beyond professional, and to have that background of 25 years, and I think it's largely, or maybe at least entirely from a point, but at least largely medication free, lifestyle medicine, excuse me, lifestyle medicine heavy, but we're talking about distinguish and evidence based, but we're distinguishing it from pharmaceutical medicine. Is that still correct?
Yes. Well, I was on, I followed the recommendations. I was on a disease modifying therapy for about 8 years. And I can tell you in 2003, I was taking about a dozen medicines to manage all the side effects and the symptoms of the disease. And then it was in 2003 that I called my aha moment when I came across some literature. And there was a publication in the New England Journal of Medicine written by Dr. Roy Swank, who wrote about multiple sclerosis and what he felt saturated fat was playing a role in increased risk and worse outcomes. And Swank went on to treat patients, believe it or not, in the 1950s with a low-fat plant-based diet. And this was not an ideal study, didn't have a control, but he did follow 140 plus patients over 34 years and ultimately concluded in 1990, and this was published in The Lancet, that 95% of his patients remained disability-free. Now, Tom, that resonated with me because I was just looking for any glimmer of hope. And so Swank was really the catalyst that made me want to delve into the literature and really understand what role nutrition could have in the disease process. What other lifestyle parameters could influence disease, risk of disease, and progression of disease. And that was really like, wow, that was a truly an awakening, because this wasn't anything that I learned in medical school. This wasn't a topic that was discussed. So I looked at the evidence, very thoughtfully, and ultimately decided, and this was not a popular decision, it was unconventional, that I was going to very carefully taper off of the medications I was on, and I was going to optimize every aspect of my lifestyle. Now, I chose to do that because the medicines that I was taking, the disease was progressing. I was having exacerbations every 2 to 3 months. And I had poor quality of life. At that point, I was walking with a cane or crutches, even occasionally wearing a diaper. And in my 30s, it was humiliating, and just the level of fatigue that I lived under was just crippling. And again, it's not something that I would recommend to anyone. I think disease modifying therapies play a role and are important and should be discussed with an MS specialist. But for me, it was the right decision at the time. I was able to taper off the medicines, and it didn't happen in a week or in a month. Over time, I started to feel better. And I went from that young woman dependent on a cane or a crutch to crossing the finish line at a marathon. And again, that was 7 years later, because often when I tell the story, because people say, oh, I'll just eat a plant-based diet for 3 weeks and then things will get better. It's not just a plant-based diet. It's all these aspects that we're talking about in lifestyle medicine. In the book, I refer to lifestyle medicine as a wheel and the 6 spokes. And I use that analogy because some of us are so good at food and some of us are so good at exercise, but then we drink too much or we don't sleep, or we tend to ignore the other aspects. It's so important to address every aspect, every spoke on that wheel, because if some of those spokes are sort of wonky, your forward progression is not going to be very effective. So
And mhm. Yeah, and speaking, by the way, of forward, the recognition of the power of what you've written, your forward was written by none other than Dr. Dean Ornish.
yes,
Correct. And those being those 6: nutrition, physical activity, stress management, sleep hygiene, substance intake, and social connection.
social connections, yes.
Yeah, 100%. And maybe we can, in just a moment, cover those from a perspective that you might put in context, either in your own or maybe even others. Though your specialty is core internal medicine, infectious disease, I have a feeling you've connected with others in the MS community. And I want to emphasize too the power of what we're talking about here. For instance, you mentioned reducing saturated fat. Well, look, why not? You're going to get heart benefits for sure as well, and
Exactly.
the benefits of what we've even seen in terms of COVID-19 and the dramatic differences in controlled versus uncontrolled diabetes, and that's really incontrovertible lifestyle medicine for preventing or improving and reversing type 2 diabetes, let alone heart disease. So I'd love to be able to go over some of those highlights and give people a taste, if you will, of what's in the book, so that they really can then delve further. Because what I love, there are some particular things, as if we can preface this, that I love about you. I mean, you just exude great energy. But I love your non-judgmental nature, your step by step approach. That this is a, no pun intended, a marathon, not a sprint, uh,
Exactly.
and that you can take the lessons as you are ready in your stages of readiness for change. If you want to discuss
Exactly.
that, where you are ready for action, you can take those actions and begin to gain a critical mass, bit by bit over time, because that was your experience. I mean,
Yeah,
you're
I think we have to be respectful of where each individual is, right, and meet them where they are. I think sometimes when we expect too much, all of us at us, all at once, we can lose patients. I want to be as welcoming as possible and bring as many into the fold as possible. These are simple things. I think what's so powerful about lifestyle medicine is its simplicity, right? It's not all that complicated. Let's begin by just increasing the amount of fiber on our plate. Swank, when he first talked about the MS and potentially the connection between diet, recently we're starting to better understand the connection, because when he said what you put on your plate affects an autoimmune disease that affects your brain and spinal cord. Like, what's the connection? It didn't make sense. People thought he was crazy, but yet these individuals who were consuming this fiber-rich diet were feeling better living with multiple sclerosis. And in the past couple of years, there's evidence in the literature that sort of supports and helps us to understand that connection. Here's what we've learned. When we eat a diet rich in fiber, what happens? We enrich the good bacteria in our microbiome, right?
in our
And then
gut.
these good bugs produce these chemical signals, short chain fatty acids, butyrate, that then communicate with the immune system, and the immune system quiets down. It doesn't attack myelin. Isn't that, it's beautiful. It's near
It
poetic.
it is, and as a matter of fact, when people ask me about uh, you know probiotics and so forth, with all due respect to some evidence they have there, I said the best food for your gut bacteria is fiber that's going to essentially tease out the harmful bacteria, at least in terms of mass quantity, and help the healthy gut bacteria, which then digest fiber. We can't, as humans, digest it, but our commensal bacteria can, right? And break it into these compounds, short chain fatty acids like butyrate, that do then get absorbed and have great effects,
Exactly.
even maybe even reduce your appetite a bit as well. So it's really a no-brainer as far as what to do, but how to do it is where we're trying to help people, and your book is trying to help people, because we know that there's something, what to do and then how to do it. And as simple as it is, um, sometimes I will differentiate. Maybe this is exaggerated, but simple from easy. If your friend is stuck under a car, it's pretty darn simple. You better get 8 strong guys fast and lift the darn car. You don't need a
Right.
PhD or physics formulas. It's not easy, but don't make it complicated, because it's really not. It's not complicated. So
Not.
let's at least
Right.
not start with
Yeah.
that. So if you will, then in the book, in the those 6 particular principles, and understanding that when you talk to your physician about this, and we are very well aware, even in our own community, that many docs still, although they're coming around, even if they have, they're still not yet, they haven't yet been able to address their own level of education, lifestyle medicine. So don't be afraid to expect a tired doctor seeing 20 to 30 patients a day to maybe not be able to process this. But as you said, also, we also want to emphasize, we are doctors, but we're not your doctor. If you're watching this, you really need to take this as a moment of insight and education,
Exactly.
and work with your team. So let's start, and I'll even start with one of my patients I didn't even expect, who had rheumatoid arthritis, a different autoimmune
Yeah.
scenario. She was on disability. Lynn was her name. And she came through the program that I was running at the time. And we really, obviously, we based our whole, our concept was kind of flexitarian, if you will, because we wanted to be flexible, to the person wherever they were starting.
I
And yet,
agree.
as she progressed, yes, she happened to lose weight as a side effect.
Yes.
And it really was mostly a side effect. And I reached out to her some, years later. I just want to see how you're doing, because there is, a lot of recurrence in lifestyle, and but yet people who go through an intensive type process or learn these type of skills and have a resource like your book can do well. She is uh, off of disability, back to work as a pharmacy tech, and open the tops, and she's having inflammatory tests and markers that her rheumatologists are doing, that she says are over 50% better. I just, starting with that, her big issue admittedly was nutrition. I didn't find she had a lot of psychological issues and so forth. She just didn't she was so confused about nutrition. Many come to see us and they really have a lot of mind matters issues, and everyone starts their own way. But with that being said, either yourself, or you can use one of your 6 and present someone in any way, whether it's MS or diabetes in your practice, and I'm sure you see a lot of infectious disease associated with diabetes, however you like to go through it. But give us a nice tip and context on each of your 6.
Sure. Well, I mean, with the food, I think it's important for us, like as I said, to meet individuals where they are. So many of my patients at the first visit, they're eating, bacon and eggs for breakfast and cheeseburgers for lunch. So we have to, it's a journey. So we start off with, what could you do today? That's simple. Like I have a patient of mine who first visit came to see me. He's like, "Doc, there's no way I'm going to give up steak. Every Friday I eat a steak dinner and I look forward to that dinner every week. And there's just no way I'm going to give it up." So let's start there. Instead of the steak, and I use this example in the book, instead of the steak covering up half of your plate, are you willing to cut it down to a quarter of your plate? And that potato, instead of putting butter and sour cream on it, let's just put, some chives, or, a little bit of pepper. Are you willing to add some herbs to that? And then let's fill the rest of that plate with some colorful veggies. And we talk about why veggies are so important. We talk about fiber. We talk about antioxidants and phytonutrients, and how that is going to affect him on a cellular level. So we have these conversations with patients. They understand. And what happens is, okay, doc, I'm willing to try that. And little by little, they start to see the benefits. As you said, what a great side effect to lose weight. I mean, that's beautiful. All of a sudden, they see those outcomes. Weight, the scale's moving, their cholesterol is improving, their fasting blood sugar is improving, their hemoglobin A1C is improving, and that inspires them to continue on this path. And as you know, our taste buds change. So the individual that once loved that bacon and egg and cheese sandwich can come to a point where I find that unappealing, and I'm not interested in that, because my health and well-being and my ability to age gracefully, to spend time with my family and those I love, that to me is more valuable than this food that I now know. I now have the understanding and the education and the empowerment to realize that this food is causing me a lot of damage and is going to compromise my ability to live my best self. And that's the way I think we can approach this and be most successful. Because if we um, address this in this manner where we say it's this way or the highway, then you're going to lose patients. You have to be respectful of where they are when they come in. And there are some patients who come day one and they're like, I'm ready to change everything today. But that's again, we talked about the trans theoretical model of change, and we have to assess readiness and meet them where they are, and in a very and the other thing I love about lifestyle medicine is it's about creating a relationship of trust with the patient, right? That
Yes,
interaction, and
yes,
it requires time. It's very different from our healthcare model today, where we're expected to see a patient every 15 minutes. You can't really do that with lifestyle
yes.
medicine.
Yeah,
Lifestyle medicine,
yeah, it's
medicine
more
is
of a
about
partnership than prescriptive.
right. It's a partnership rather than a prescriptive. So it's a different model altogether. But once we get it working, it is incredibly powerful. And I've had the great honor of doing this because really, about 9 years ago, I sort of left behind the infectious diseases part of my career because I really wanted to focus on this, because I think it is so incredibly powerful and regrettable that as physicians we don't speak to this. I think about my own doctors, Tom, who were the best and extraordinary physicians, the best leaders in the field of multiple sclerosis, and they were incapable of offering me the one important prescription that I needed in order to really turn the course of my disease. And again, I think it's disease modifying therapies, and we've come a long way. When I was diagnosed, there was only one drug approved by the FDA, a drug called beta seron. I think now we have more than a dozen medications with different efficacy and safety profiles that every MS patient should be well aware of and have a conversation with their doctor. But if, as MS doctors, if we're just prescribing disease modifying therapies and they ignore the fact that the patient is pre-diabetic, hypertensive, a smoker and highly stressed, if they do that, I think that that's malpractice. I
Yeah,
really
yeah,
do. I think,
it's at least it's malpractice of the system that we haven't started and taught this from the get-go, so that
yeah,
we left a team of doctors with the weapons that they now feel many admit, I'd like to do this, but and we say embarrassed, but I don't have the skills to do this. It's really unfortunate. I don't think we can leave this topic though without saying that while you might have left your ID practice in the preface to your book, you made it pretty clear, and I agree with you. Along with my friend and colleague Beth Frades, we wrote an article called "The Making an Argument for COVID Prophylaxis with Lifestyle Medicine," and it's hard. We're not trying to be judgmental. We're trying to explain the urgency of a tool so people have, even currently now. The book that you have, you can put to work, and it may very well. I mean, if you're talking about blood sugar control, for instance, obviously hypertension, quitting smoking, coronary disease, all of the things that lifestyle medicine can address, you may acutely reduce your risk for developing potentially a case of severe COVID-19 or potentially a mortality case.
absolutely. And I added that preface. I had turned in the first version of the book around this time last year, and then COVID came, and my publisher and I had a conversation. We really need to add this preface and speak to this. And it's an uncomfortable conversation because we are in the midst of this. We're losing Americans and global citizens every day. It's a very painful experience. But I think it's important that we speak to this connection between the chronic disease epidemic and this acute COVID-19 pandemic. In the summer, the CDC shared some surveillance data that illustrated that if you had a chronic disease at the time you were infected with SARS-CoV-2, that you were 6 times more likely to be hospitalized and 12 times more likely to die. Tom, I mean, that's powerful data, and we have to speak to it. All of us in the field of infectious diseases, and I hope that my colleagues in the field they're on news media every day talking about the pandemic, and and the vaccine, but take that opportunity also to connect these dots, bring this awareness to the average citizen that chronic disease is really creating a much more deleterious outcome with this infection. And we're not really talking about it. In our country, 70% of Americans are either overweight or obese. If you're normal weight, you're in a minority. That's alarming, and it needs to be uh, shared with the
And
American public. And that's hopefully the silver lining here, right, from this pandemic, that there's some level of awareness, that we awaken, that all of this pain leads to something positive, that we start to have these very difficult conversations about the American waistline and how we're just carrying too much weight. And it's not just a cosmetic thing. I mean, it's fueling inflammation, it is fueling disease, and it is fueling premature death.
yeah, and no doubt. And and by the way, just to, yeah, if you're just really stuck on running through the drive-through at McDonald's, get the oatmeal. Okay, now I'll leave that aside. The In terms of now the next, and we maybe can go through some quick highlights. Activity. We've seen national surveillance data. Physical activities dropped through the pandemic. That's not good. But it's not complicated, right? I think you, I, Dan Buettner from Blue Zones, we're all trying to send a simple message that we can simply
Walk.
walk. Thank you. It's not, and it
That's
doesn't.
all.
Yeah, I don't even need to. I mean, look, do the exercise and everything in the moderate to intense, but even light amounts of light activity intensity, but split up throughout the day and all kinds of little opportunities
Right, find
works.
opportunities to just get up and move. I know there's the hip movement and everybody and the gyms, but listen, just getting up and moving and getting in that physical activity is all also so powerful. And that's really in my exercise chapter. That's really what I talk about. It's just about moving and walking. Like every morning, I wake up at 5 o'clock, and at 5:15, I'm outside and I'm walking at least 30-40 minutes, and that's an incredible way to start my day.
Yeah.
And you don't need to join a gym or buy any expensive equipment, but it's really so powerful. And if we all did that, and you're right, in the midst of this pandemic, what are we doing? We're sitting indoors and we're not moving, which is further worsening all of it.
And Sarai, you're living in New Jersey, correct?
Yes.
So I'm in Detroit. Our weather isn't much better. So I will actually go to, if it's that bad. I love walking outdoors so much. I mean, I have a hate-like relationship with a treadmill. In other words, I will do it if I have to,
I,
because I love walking that much. But I'll go to a parking structure that's pretty empty, and I'll just walk in the up and down the levels. Kind of is my incline, because it's safe. It's not snowing on top of me, and you can do it, people. I guess that's what we're trying to say. If you had a stress management highlight that you would maybe apply to yourself personally, what's the one thing you do on a daily basis that's time friendly for people that are just, they're maybe in contemplation phase, and we want to just nudge them a little, that it's not 4 hours of meditation and so forth. But
yeah,
what's your
for me,
highlight?
I use prayer. That's powerful for me. Prayer, meditation, quiet time. And I think one of the it is being able to change your perspective. But one of the biggest lessons I learned was this: learning how to accept what is. I think so much of our pain and suffering comes from not accepting whatever comes in our path. And I think when you release that, when you're allowed to, when you say to yourself, whatever challenges present themselves, rather than pressing against them, allow them to be, and accept them, and so much of that pain and suffering just dissipates. And that was a big, because for when I was first diagnosed, a lot of my pain and suffering came from, this isn't fair, why did this happen to me, and just being angry. And at some point I accepted the diagnosis, and there was a freedom in that. And that's where I began to really build. And you know what, I say this often, and so many of my patients find it hard to believe, but October 11th, 1995 was both my most difficult day, and it was also my most beautiful day. And I'm grateful for it, because yes, there was a lot of pain and suffering, but it led to a an ability to arrive at where I am today. And it's been enlightening, and hopefully the lessons that I've learned and then I've been able to share with my patients and my community will serve them. And what could be more wonderful than that? To, as a physician, this is why I pursued this noble profession, is to serve my community, to improve their quality of life. And I think that my diagnosis has given me a perspective that is unique as a patient and a physician, to really understand what chronic diseases and the pain that individuals experiencing chronic disease have, and hopefully this little book that I've written, Tom, serves those in some important way.
What's missing from medicine, definitely go out and get it. I remember hearing a someone said, when I brought up a positive perspective, positive psychology perspective, but simple one we all know is a cup half empty or cup half full. And I think they took me to where you're talking about when asked the question, why is the cup twice as big as it should be? And I said, okay, yeah, there you go. I mean, look, we are here, we have an opportunity to live, and you really learn from your experience how to see beyond the just the typical, and would not have had the ability to spread this word to so many people. In terms of sleep, what a challenge for all of us. I mean, being in medicine, you just mentioned the 36-hour shifts. We slept with one eye open, and even as exhausted as you were on that October day 25 years ago, you still woke up when that pager went off.
Oh,
So
sure.
we're I think maybe we have a legacy of sleep issues after medicine, but we all work on it. I have obstructive sleep apnea, believe it or not, even though I'm 45 pounds lighter than I used to be. I wear CPAP. There's other issues, but the bottom line is, what are some of if there was one or two really important, at least plant seed tips, if not an actual action, whether it's why or what to do regarding sleep, what would you say
Yeah, I mean,
to
I
our
think the most
workers?
important thing is structure and environment. Structure, people don't realize it's so important for you to create a schedule for your sleep. So you go to bed and you wake up at the same time every day. It's so, so important. So, and creating, sleep hygiene is also about addressing your environment. Your room should be cool, dark, and quiet, right? We shouldn't be, these deadly phones that we're constantly looking at, and the blue light that is emitted, and the television screen and the iPad screen. And people are doing this right before they go to bed, and they don't realize how that compromises the physiology of sleep in the brain. So staying away from all of those things, creating an environment in your bedroom that is conducive to effective sleep. But structure is the one most important bit of advice that I can offer individuals. I can tell you, Tom, that for years, I was a terrible sleeper, definitely had insomnia. That's probably a consequence of being a medical resident and medical student. And also, once I was diagnosed, because of the medicines that I was taking, the beta serum, I would inject this every night. I would wake up with shaking, chills, and fever. So my doctors put me on Ambien to get me to sleep during those difficult moments with the medicines. So I was addicted to Ambien for years, and tapering off of that medicine was one of the hardest steps that I had to take in order to put myself on the right path. But once I learned sleep physiology, I think that is the most powerful intervention that I introduced, because sleeping well to me is magic. I mean, really,
Yeah.
I go to bed, don't tell anybody, at 9 o'clock, but that's my
We're
schedule.
going to
That's
tell
what
everybody.
everybody laughs at
And-
me but that's what works for me. nine
yeah.
o'clock, 5 o'clock. And I wake up in the morning with a ton of energy. And I feel so blessed. I mean, think about, Tom, I've had this disease for 25 years and I take no medicine. And do you know, on October 11th, 2020 was the 25th anniversary of my diagnosis. And on that day, I walked 25 miles with family and friends. Yeah. And I
Wow.
celebrated. Yeah. And I felt great after walking those 25 miles. And they told me I would be in a wheelchair within 10 to 20 years. So I
That's
have surpassed.
amazing. That's amazing. And to your point of sleep, I mean, we're now learning literally that sleep and getting good and deep sleep is quite literally squeezing toxins out of you, cleansing your brain in a way that
Is. Yes,
yes.
it's so powerful.
So and I think you made a phenomenal testimony in terms of your uh, explanation regarding substance in terms of that key area. And as we're winding up here, one thing that I want to help as really make clear, we talk and we hear this term about social distancing. I try to emphasize it's physical distancing, not
Yes.
social distancing. And it's hard for everyone. What's happened is kind of broken lines of communication that, I have friends that I largely, to places that I knew had scratch cooking so I could tweak my orders the way I wanted. But our relationship was built around, being at a restaurant. And I realized I'm not connecting with these people. So I'm making an active effort because it's really been so nice to connect. Social connection.
So important. Loneliness is a great contributor to premature death, and people don't realize that. So it's so important for us to have these social connections. And in the midst of this pandemic, we are largely isolated, and this is fueling depression, and we're seeing suicide rates climbing. So it's important for us. We're socially connecting today, right? Having these interactions are so important, and they're part of the medicine that we need in order to improve our health outcomes. And again, these are very small, I mean, these are very simple messages that we're offering today, but yet don't think for a moment that its simplicity is somehow lacking in
In
power.
power. Absolutely.
So
Be
incredible
empowered.
powerful. And
Do-
when we address them all simultaneously, when we address all of these spokes on that lifestyle medicine wheel, that's what I call the sweet spot. That's where we reap the greatest benefit, Tom. And it is my hope for everyone that we all age gracefully, right? That at like age 98 or 102, after spending the most amazing day with loved ones, we go to bed and we don't wake up. That's the
Absolutely.
happy
How
ending.
inspiring. I love it.
Yeah.
uh, Author, Dr. Saray Stancic of What's Missing from Medicine. Well, you've just filled in the gap for us. Thank you so much on behalf of the True Health Initiative and everyone that has been able to hear this wonderful message. I hope and wish you all the best. And I can't wait until someday we get to not necessarily be so physically distanced and then have a chance to connect again soon. Thank you so much.
Thank you so much, Tom.